Namaskaram. I'm Dr. Neeta Joseph. I'm a psychologist and currently I'm speaking from Oman. Today I wanted to talk about an experience I had with my friend when I was visiting her. She has a 3-year-old son, and I could clearly see that he has some problems relating to attention deficit and hyperactivity. And when I hinted it to her, she said, no, he's playing naughty. He's a very naughty child. So I thought I should make this video where I am talking about some things which are relating to something called ADHD or attention deficit hyperactivity disorder. So when we are talking about ADHD, there are three things that have to be kept in mind. Firstly, it is the inattention, the lack of attention, which is the attention deficit part. And then the next one is the hyperactivity part, the overactivity part, the part where children may be a little disorganized and forgetful about their things. And there could be a combination of these two, where the child is inattentive plus hyperactive. So it could happen without the combination also. And mostly it is diagnosed from the ages of 3 to 7, but it can be diagnosed mostly even in children as young as 2 years, sometimes it can be diagnosed. It is very rare. But yes, by the time the child is 3 or 4, the signs are very evident. So when do we know that I have to be a little cautious about what my child is trying to show me? That is when I have to see to it that to look out for these signs and then understand that it is not plain naughtiness and there is something beyond it. So, firstly, is first warning sign would be when my child cannot behave well, even when he is among people who with whom he would like to behave well. He's not able to, though he or she wants to behave well. And sometimes naughty children can sit in a place when they are rewarded, or at least when they are bribed. Huh? So, if you sit well, I will give you an ice cream or something, they'll be able to sit well. But children with ADHD find that very difficult. And when, in spite of reinforcements, in spite of guidance, they are not able to sit properly, unable to sit still for some time. Even for a couple of minutes, it becomes very difficult for them. And though they may be having things which are very dear to them, they may forget these things. They may not be able to place it. They may not be able to remember where they have placed it. And sometimes they are so impulsive that they are not bothered about the dangers of their steps. For example, if they have fell from one place and hurt their arm or something, they still would continue with that same behavior even if it has hurt them physically. And there could be also emotional issues, temper tantrums, especially emotions like anger. They may find it very difficult to control these emotions and they may throw a fit anytime. And another thing which is of importance is though they might be dead tired, they may have problems falling asleep. Even if they fall asleep, they may not be able to sleep as much as other children may be able to sleep. So it might be very difficult for them to be in that sleep. And so these kind of sleep problems also may be evident in children like this. So I think you must have got an idea. And if your child shows such signs, I think it is better to consult with a pediatrician. They may be able to guide you, or a psychologist. I hope it helps, and I hope all of us benefit from this video. Thank you.